Hey there, if you've ever had neck pain or stiffness or tightness, this video is for you. Hello, I'm Dr. Brandon Bupp at Advanced Health and Wellness Center, and we're going to go over some cervical spine, some neck stretches and exercises that you can do at home that will hopefully help to maybe relieve some tension or stiffness or tightness. Guys, disclaimer, I don't know what your medical problems are. This is a general information video. And if the stretches cause you to have pain, please discontinue them. And then I also want to emphasize that these stretches are not going to fix anything. They're not going to fix any cervical spine problems. You do need to be evaluated and you do need to be checked. And really probably you need to be adjusted on a regular basis. But these are things you can share with people at home. Some general concepts or ideas for stretching. So the first one is we spend a lot of time with our heads forward and looking down. And so we put a lot of stress and strain on the muscles in our neck. We want to try to work on that. The most neutral position, the most optimal position for our head is actually for our ears to be over our shoulders. We're not used to that because if I say do this, people go, well, that feels weird. Well, that's because we're always looking down and always looking forward. So the first stretch that we're going to do is we call it, there's a four-way stretch. So the first thing that we're going to do is Eric's going to tip his head back and to the left, and he can take his hand, put it on his forehead or put it on top of his head also, and basically just use the weight of his head to stretch this muscle, these muscles in the front, the SCM, and that's going to just give them a little bit of relief to these muscles that are constantly tight. So we're going to hold that for 30 to 45 seconds and then relax. And then we're going to go the opposite direction. He's going to do the same thing, right arm. So listen, he's not pulling with this arm whatsoever. It's just the weight of his arm that's helping with the stretch. I would do it with no arm first. So just leaning your head to the side and back. One important concept that I want you guys to be aware of is that he's not turning his chin away from the direction he's leaning. We want the chin and the nose and the forehead and all of this, we're all going the same direction. We don't want that because that's putting strain and tension on his neck. And when people are doing that and they're making a popping sound with their neck, it's actually really bad because it's torquing these joints, okay? So we've got left and back. Show them left and back. We've got right into the back. And then we go forward into, there. And so we can do the same thing. So be aware, he's looking at if he had a pocket on his shirt, he'd be looking at the pocket of his shirt. So then he can add his arm to that. He's not pulling, he's just using the weight of his arm to increase the stretch. So that's stretch in the back left, and then he's going to go to the left and down, same thing, he's stretching there. So again, we're going to do each one of those for 30 to 45 seconds. Just getting a nice easy stretch, okay? So then the next thing he's going to do is look up at the ceiling, okay? And just let the weight of his head lean back, all right? And that's going to be stretching the front. So that's the fifth direction, okay? And relax. So one thing that I wanted to mention, before we actually start these stretches, we're going to do some warm-up exercises. So all he's going to do is tip his head to the left and then tip it back to the right. So it's just a really nice, easy tip left, tip right, keeping the chin neutral. So again, not turning the head, but just tipping. So it should be over that axis. And then he's going to do that for about 30 seconds or 45 seconds. He's going to turn his head to the right and then to the left. We do this before stretching, okay? So we're warming up the tissues in the spine. All right, and then he's going to go forward and backwards. Forward and backwards. Now, he's only going to the point of comfort, okay? So if it hurts, don't try to force your spine to turn any further. Only go to the point of comfort. That includes all of those directions. So 1 is lateral, just tipping side to side, okay? 2, rotating, and then 3, forward and backward. All right? Another thing that we're going to do to help with tension on the shoulders, Matt, if you want to come over here to the side, what I'm going to have Eric do is roll his shoulders, not forward, but roll his shoulders backwards, okay? Because we spend so much time in this forward position, we want to work to get our shoulders back. So he's going to roll his shoulders backwards. Again, he's going to do this for about 30 to 45 seconds. Now, all of these stretches and exercises you can do repeatedly. So we do 1 set, 30 seconds, 2 sets, 30 seconds, 3 sets, 30 seconds. You start with 1, just doing it 1 time, going through everything once. All right, so first we've got the range of motion exercises, okay? Rotational, forward and backward, side to side. Okay, second, we've got the shoulder rotations, okay? Backwards, not forward, backwards. And then lastly, the third thing we do is the stretches. So we're going to do those 3 different directions of stretches, or I'm sorry, 4 different stretch directions. Back and to the left, back and to the right, down and to the right, down and to the left, and then the 5th one, which would be just straight back. Okay? So those are the stretches, and then I'm going to show you one last what we call traction thing that you can do. I do want to mention this. The upper back and chest is always related to the neck. So the neck is not disconnected from those structures. In the chest and the upper back, we must also do a stretching and mobility program there, and we're going to show you that on the next video. All right? Not to give you guys too much information at once. So the last thing is you're going to take, if you have a Denny roll, this is a Denny roll from CBP. You can get them from lots of different places, but that's what we use. You're going to take a towel. If you'd like, you could just use a towel. If you're starting this, you haven't done it before, just roll up a towel, a bath towel, into a circle like this, and then you're going to lay back. So Eric's going to lay on back here, and I'm just going to place this under his neck, right in the middle, okay? Right in the middle of the neck, which you would do the same thing with the towel, and you're going to do that for a minute or 2, as long as it's comfortable, and you can increase that as you increase the time as you go. It's better, and all he's doing is just letting his head hang there, okay? So we're trying to remold a proper C-shaped curve in the neck. So when we're looking down, it starts creating tension and stress on our spine. This is going in the opposite direction that we're in the position we're in all during the day, and it's also going against gravity. So we're remolding. It's called spinal molding or spinal hygiene. We're trying to reinstitute the normal cervical curve that's supposed to exist. Okay? So come on up, Eric. So that's it. If it causes pain, don't do it. We would rather you have something that's a hard foam like this. You can get these in our office. They're really not expensive. Something that's going to do some molding of the spine. But again, if you have a neck issue, chiropractic is the key, because if the joints are not moving properly, it doesn't matter how much you stretch it. If you have bad alignment in the spine, it doesn't matter how much you stretch it. It's not fixing the problem. It's just trying to give you some relief. So this is for our patients. This is for the public that maybe is having some pain and would like to get some relief of it. But please understand, if we don't have good biomechanics, we can do stretches and exercises all the time, and it's not going to really impact us as much as it needs to. So that's it for us today. If you have any questions, please let us know. We'd be happy to help you, and we hope you have a great day.